We are so fortunate nowadays that it seems like the borders are disappearing. People are travelling overseas. Not only they're going on holidays, but they're also choosing to have their medical treatment done overseas and their dental treatment. We're fortunate that we have these choices nowadays, and there are fantastic surgeons all over the world. However, there are risks associated with having your treatment done overseas. The nature of surgery is such that not only it's important how it's done, but also the follow-up. A lot of the complications that happen after the procedure, not during the procedure. And if they do happen during the procedure, the surgeon can usually deal with them right there and then. But what happens when you leave the hospital, you leave the office? Who's going to look after you then? And that is the biggest concern and the biggest question that you need to ask yourself. The nature of implant treatment, especially when grafting is involved, is such that it's a treatment that goes on for quite a while. If we have to regenerate your bone, we have to wait 5, 6, 7, 8, 9 months sometimes before we can place implants. And then implants are not a one-size-fits-all type of situation. We have to wait anywhere from 3 to 6 months before we can make your crowns. And also for implants to be successful, some of them need to have that crown attached pretty quickly, and sometimes it has to be done over a long period of time, not to overload the implant. So there are a gazillion of variations that I can think of that we usually look into before we even start our treatment. And typically when I see patients, I see them on a monthly basis for reviews. If there are any complications, we deal with them right there and then. It is not uncommon that I have somebody who comes in to see me and they tell me that they had implants done overseas and they developed an infection on their flight back to Australia. It can happen. It can happen to anyone. It can happen to any surgeon, even if it's the most skilled and experienced surgeon in the world. But the question is not the surgeon's skill. The question is who and how is that going to be resolved? And by the time you get back home, it might indeed be too late. There are lots of other possibilities that I can think of. Sometimes little caps or attachments to the implants can fall out. It's very easy to replace them if your dentist is local, but what are you going to do if they're overseas? With more involved treatments, especially with full mouth rehabilitations, there are so many steps and stages to that treatment that you do actually need to see your dentist regularly. It is not possible to do it successfully and well in 1 week while you're holidaying overseas. So if you are getting it done in 1 week, you have to ask yourself the question, why is it being done so quickly, and how well is your body going to respond to this treatment that actually needs to be done over a period of time. And it's not that we want to do it over a period of time, we want to give you quick results. It's just that the biology dictates that bone takes 3 months to heal, that gums take 2 months to heal, so we need to be guided by that. Another common problem that I see is implants that have been done overseas and they've been done well and people haven't had problems for a year or two, and then all of a sudden something happens to the crown, and in fact the implant might still be okay and integrated with your jaw, but the crown needs to be reattached or remade. Often systems are used overseas that are not actually available in Australia, and we just don't have the hardware. We can't order them, we can't get them, we can't even get the dentist who did them to respond to our emails to assist us. And often we have very difficult problems on hand that we sometimes can't even resolve. I understand why people choose to go overseas to have their medical treatment. Costs are higher here in Australia. However, the costs of potential complications are built into our fees. And if there is indeed a complication, we take responsibility for it here. We try to help you. We try to solve the problem. However, if it is done overseas, then to try to resolve it, we have to charge you for it. So at the end of the day, is it really cheaper overseas? It's questionable. In some situations it is, in other situations it's actually more expensive to try to solve problems that were created unnecessarily.